Hey, for those of you who don't know me, my name is Pamela. I am 26 years old and I have non-Hodgkin's lymphoma. This video is going to be all about how I found out that I had cancer. I'm going to do a few short videos about my experience so far. I have a specific type, but I want to get into that in a different video. But just a little information about me. My background is that I'm a registered nurse. I'll be 4 years in March, and all of my experience is hospital experience. I've only ever been a floor nurse. I'm currently in critical care, going on 2 years there. But the only reason I say that is because I'm going to be talking about my experience as a patient, but also what it's like to be on the other side of nursing, because it kind of makes my situation a little more unique because I have a different perspective on everything with me having that medical background that I do. So my story starts in October. It's currently January of 2020 and this was October of 2019. It's pretty much the whole month of October. I was in the hospital for 17 days and it was not related to my cancer. I had a virus infection on my liver. It was really rare actually, and it alone has an 80% mortality or death rate because most people they have general symptoms, so it's really hard to diagnose. And it's usually only found in pregnant patients or patients that have a suppressed immune system from maybe like HIV or something similar to that. Mine may have been because I have the cancer, so my immune system is a little bit lower from that, but other than that, I couldn't tell you how I got it. Nothing I found when I researched it really told me much of anything, just because it is so rare. But the initial reason that I ended up going to the hospital, starts at the beginning of the month, was I had got bitten by a spider, and from the spider bite I got staph into the spider bite, and I was taking antibiotics for it, but then I started developing these fevers even though the staph infection was going away. So, and I had abdominal pain and pain like when I took a deep breath, so it was just like chest pain. So they admitted me, did some different blood work. I had an infectious disease doctor on my case, and if you've ever had an infectious disease doctor or you've had a patient that had an infectious disease doctor, you know that they do like every kind of lab under the sun, trying to figure out what's going on. They had me on some antibiotics, but the reason those weren't working is because antibiotics are for bacterial infections and antivirals are for viruses, and I had a virus. They did not know this at the time. They did an abdominal CT and saw that my gallbladder was inflamed and enlarged a little bit, and they saw like something that may have been like a cyst near my liver. So the general surgeon came and talked to me and asked me if I wanted my gallbladder out. He said that he doesn't take them out just for my situation. Usually it's if there's an infection there or if there is gallstones, which I didn't have. So he said it was completely up to me. I decided I wanted it out because I was hurting pretty bad and we didn't know what else was going on, and it's not really a vital organ, so I was like, why not? Let's get this out. Something's going on. So while I was in there, they discovered, so your gallbladder sits in front of your liver. When he took my gallbladder out, they could see my liver better, and they saw that it had necrotic tissue, which is dead tissue. It had some discoloration. I had scar tissue on my diaphragm and on my right lower lobe on my lung, which explained the chest pain. They took a biopsy of my liver to see what that was, and then the cyst that they thought I had was actually an enlarged lymph node that's close to my liver. So after he did the surgery, he told me about everything they did, and then said that the next day they were going to do a CT needle biopsy of my lymph node, but usually these things are benign and not to really worry about it. Well, a CT needle biopsy, all that is like where they take this pretty big needle and they use a CT to guide them to see where to go to get the biopsy from. That's all that is. For that, I was mildly sedated. It didn't really hurt. I couldn't really feel much of anything. After they did that, they decided to transfer me to Jackson for further care on the virus that I had, and to see a hematologist up there about this biopsy they had taken. So they transferred me. I was only at the first hospital for like 5 or 6 days. The rest of my time was spent in Jackson, where I was getting medication for the virus that I had. But I don't remember exactly what day it was that we were there, but the hematologist came in and spoke to me and my mom and told us that in fact I did have cancer. And then he started talking about chemotherapy, and just like the TV shows and movies, I couldn't tell you what he said after that. All I heard was chemotherapy, and then the rest was just noise. My mom was with me. She was with me the whole time I was in the hospital. She had breast cancer when I was, I want to say like in the 5th grade, 4th grade maybe, in 2003. She's been in remission since. It never came back, or it hasn't come back, so that's great. But she does have that experience with chemo that I was able to ask her questions, and she said that she's still come to all of my chemos, and she knows what, she has like that certain inside input that I guess I was needing at the time. So they decided that I needed a bone marrow biopsy, which is when they take this like thick, long needle and they put it through the bone into the marrow, where they can collect blood samples and a part of the bone marrow, which is the core, and test it to see if I had lymphoma there. Because at this time, we know that I have lymphoma, but we don't know what stage or anything like that. That is determined by a PET scan, which I'll talk about in my next video. But that was probably the most painful procedure that I had of all these procedures I had in that month. It wasn't too bad, but I definitely could still feel things, especially since he had trouble getting the core. And he'd hit a nerve every now and then. And even though I had the same medication I had when I had my needle biopsy for the lymph node, at this point I had been in the hospital for quite a while, and I had been on some IV pain medication because of how bad and intense my pain was. So I was more awake for this one. I was able to have a full-blown conversation with him, and we were able to talk about like some of the doctors that I had worked with at my home hospital, because he did his residency there and he knew a few of them. Was asking questions, trying to keep my mind busy, I think. But thankfully that came back negative. I didn't have it in my bone marrow, which is a good thing. But I was able to go home October 30th. At first I thought I was going to have to go home on IV medication for the virus infection, because they weren't sure that I was ready yet for the pill form, but they spoke with infectious disease and she told me that I was good to go on the pill form because of how responsive the virus was to the medication I was getting. But they were holding off on all chemo until everything's cleared with infectious disease. But and I'll get more into that in the next video, because there was actually a lot more that went on before I could actually start my chemo. But that's pretty much in a very condensed nutshell, because I wanted to keep this really short, how I found out that I had cancer. If you have any questions about anything that I said, or any of the procedures, or my time in the hospital, like, I will gladly answer them. I'm really open about my situation, and I don't mind talking to anybody, answering comments or messages at all. I just think it's really important for people to know that they're not alone in things. It's really important for your mental health especially. And when you have cancer, it doesn't affect just you, it affects everybody you know that's close to you. So if you have any questions, if you have cancer or you know somebody that's close to you that does, and you just are more curious about some of the things, like, just ask me. I don't mind answering questions or talking about it, and I actually enjoy when I can make somebody feel a little bit better. But yeah, that's my story so far, and stay tuned and I'll tell you more later.